How's it going, guys? So it is officially 2 weeks after my surgery, and I've been doing pretty okay. A couple things have been just kind of on and off. I tried to start going back to work. I know it seems a little quick, but the doctor did give me the go ahead that if I feel better about going into a car, that I should be able to, be able to kind of go to work. Um, so I tried that on Wednesday. That was officially 2 weeks, like after my surgery, and I did way too much. um, you guys definitely want to make sure if you have some kind of injury like this that you really take the time to kind of like recover. I wouldn't say recover completely, but like, listen to your body. I had like 5 clients in a row, and thankfully that was like my whole day, but my knee felt so sore, kind of really achy, and I definitely just overdid it. Something I'm constantly trying to work on is, taking the time to actually recover. And I know this should be a long process, but the person in me wants to just like go, go, go. But since that day, I've only taken like clients at 2 hour intervals just to give myself a good amount of rest in between. Because yeah, like the ice obviously helps out a lot, and then like still taking a couple of pain meds, not anything crazy, just like the naproxen and the aspirin. But I digress. If you guys do get the go ahead for like ability to walk and stuff, make sure you kind of ease back into work, because I didn't, and I definitely paid for it the next couple of days. As far as physical therapy goes, I have just been staying consistent with my exercises. A lot of hip strengthening stuff, and a lot of trying to get quad activation. There's a lot of atrophy that comes with an ACL tear, just because of non-usage for a good amount of time. And so I've just been consistent with those, trying to stay on top of it as much as I can, strengthen as much as I can, but not push myself to where it hurts. Just staying within the parameters of what my PT gave me. So it's like 3 times a day, 3 sets of 10, easy-ish stuff. I say it's easy because it's easy to remember, but it's not entirely easy to do. Mentally, I'm getting a little bit better. I'm able to step out of the house, which is amazing. Because you get a little bit of cabin fever when you're sitting at home for a long period of time. But if you have the ability to go outside, or even have people come visit you, definitely have that. But it is nice to kind of be able to go step out and do something. We were able to go see a movie. We saw Thunderbolts, really good movie. And I've been able to go hang out with a couple friends outside for a short period of time, but still able to do more things outside of the house, which has helped out immensely. Like the first week, I was definitely a little depressed. Into the second week, I was definitely having a hard time, but now that it's been a full, I think 14, 15 days, it's getting a little bit better. So definitely tough it out, keep yourself busy. I'm still resting up a lot. I've been working a lot on puzzles, or just a lot of stuff that I can do for my business, which is good. But just try and keep yourself busy, because if you sit there and just rot, you're not going to even recover all that well, honestly. You got to keep yourself busy, make sure you're doing your exercises, and yeah. I also wanted to touch on some of the nutritional stuff that I've been kind of going through. I had a lot of suggestions from a lot of different people too, that helped out a lot. If you're a little bit on the holistic side and you're not trying to use a bunch of pain meds or NSAIDs, I was using turmeric pills, turmeric with ginger, and then I think it had pepper in it. That was a really good anti-inflammatory. It helped with my swelling a lot post-surgery. My doctor also I'll put a link down. It's called, I think, XR. It is a protein supplement. It has creatine, amino acids, just to help with the muscle recovery as I'm going along with the exercises and stuff, trying to build back up my quads. And then the doctor was also saying like you got to make sure you're eating like full meals. I think a lot of the times I was definitely a little like not hungry, but I always made sure that I made like had enough protein, had enough of my carbohydrates and healthy fats. So you want to definitely make sure that you're eating like good full meals. Make sure you're still getting like your grains, your vitamins, your minerals. If you need to, try to get on like a multivitamin if you're not getting enough of that stuff. All these things are just going to kind of help with your recovery also. Because a lot of times, again, if you're sitting around, you could be deficient in a lot of those things, and your body's like recovery is going to slow down. So definitely make sure that you're still eating enough, and that if you need the supplemental help, that you can talk to your ortho or your doctor, and they'll be able to kind of help you out a little bit with like suggestions. I think the next time I'm going to do one of these videos will be probably in a couple of weeks. I just don't want to keep you guys like too bored with things that I'm doing for each separate week. So I'm going to kind of slow it down for like every other week. Give you guys bigger updates and more tips in that way. But keep following along, and I'll see you guys next time.